I spoke with Baystate Health President and CEO Mark Keroack exclusively Friday. He tells me the case count in their COVID-19 outbreak has now increased to more than 30 employees and 9 patients testing positive, and there are many more in quarantine.
We've got hundreds of people quarantined waiting for their test results to come back, so there may be a few more positives that come to light, but it's something very serious. We've done deep cleaning of the unit, and there's no more evidence for any transmission.
Dr. Keroack did not disclose the unit of the hospital where the cluster originated earlier this month. But he did tell Western Mass News the latest theory in their contact tracing efforts indicate it could have come from a patient who was transferred into Baystate from another hospital. He says the patient reportedly tested negative for the virus and then tested positive a few days later. Keroack says this supports the CDC recent guidance indicating that a negative test result doesn't mean a person can't spread the virus.
Testing is certainly part of protecting yourself, but it's not the whole thing. It's really kind of a package that you've got to put together, and testing is part of a defense strategy, but it can't be the whole thing.
As this outbreak is closely monitored, Dr. Keroack says he has his eye on the growing case numbers overall in the community.
Western Massachusetts is surging right now.
He says statewide statistics show the number of people in the hospital has tripled, and numbers have increased at Baystate.
We were in the 30s and 40s in October, and we got as high as 90 a week ago. Today, thankfully, we're down at 70. I hope that's a trend.
Keroack says in April the hospital had 180 patients with 40 in the ICU, so they have room for more patients if needed. The hospital currently has 3 COVID-19 units.
We would be able to expand to about 230 at the Springfield campus and a couple of hundred more likely in our community hospital. So we still have plenty of headroom in terms of bed space.
We also talked about a coronavirus vaccine as companies are showing promising results.
It means that there's a light at the end of the tunnel, a very bright light, and at least 2 lights, maybe even 3 or 4.
He's talking about Pfizer moving forward with its vaccine authorization process, planning to take it to the FDA for emergency use authorization on Friday.
It wouldn't surprise me at all in January if we actually had 4 different vaccines approved and on the market, which is important because we need to really ramp up production very, very fast.
And Baystate is already working on a plan to distribute the vaccine.
We have purchased a number of those ultra cold freezers in case it turns out that the Pfizer vaccine is the one we get access to.
In their plan, the vaccine would first be distributed to high-risk individuals and frontline caregivers, second to less high-risk individuals and other essential workers, and third to the general public.
It will be a kind of phased distribution, and the speed of the phasing is going to depend on how much vaccine they can make and how many different vaccines are available.
He says roughly 20 million people could be vaccinated by late December, early January. But will people actually get the vaccine? Dr. Keroack says surveys have shown Americans are 50-50 on the issue.
I think with the new administration and with the scientists saying we think this is okay, and particularly if, let's say Baystate endorses a vaccine and your doctor says that the vaccine is safe and you know that some friends of yours have gotten it, I think that 50% number is probably pretty soft and may well come down once we start getting experience with it.
And as the holiday season kicks off next week, Dr. Keroack has some concerns.
It worries me a lot that we've seen roughly a doubling in inpatient cases just before a time when people are likely to be getting together for Thanksgiving.
If you are gathering with family, he says wear a mask when you aren't eating and avoid hugging and kissing family members.
It makes for a pretty strange holiday celebration, but you don't really want to have your holiday celebration become a super spreader event either.
Keroack says people should really consider a virtual get-together or small gathering this holiday.
I think because of Thanksgiving and Christmas, it will get worse before it gets better. I don't think it'll be as bad as it was in April, but it'll get pretty bad. And then as the vaccine knocks down the number of potential targets for the virus, will start slowly emerging.
Dr. Keroack says the same message rings true as we head into the holidays. Continue to wear your mask, wash your hands, and socially distance from others. For Western Mass News, I'm Jordan McCool.